Hi everybody, this is your at-home care, which is just as important, if not more so, as a daily routine than your in-office care. So for the knee and the hips, and of course they all go together with the low back, we want to keep that all in alignment. So I'm going to give you 3 exercises for your knees. Keeps even orthopedic surgeons out from under the knife. And let's see, then we're gonna do a couple for the hips and interior, exterior, and then we're gonna do some nice low back twists. So ready? First, for your 3 knee exercises, the most important things, you're gonna do them every day until there's no pain, and then do them every day for the rest of your life. Maybe 3 times a day to start, then once a day thereafter to maintain. So the first one is, we call it the swing. It's just as easy as being a 5-year-old again. And what this is doing is building up these muscles, stretching these ligaments. It's retraining that patella to that kneecap to retract itself properly and keep you in alignment and out of the arena of swelling, and all sorts of things happen when everything's out of alignment. Now the rule of thumb is, say it's your left knee that's bothering you. You want to do 100 times. That's 1 set. 1, 2, 3, and up to 99, 100. And you want to always put the heel toward the pain. So if I have lateral pain on the outside of my knee, I'm going to look like this. And I'm going to do that 100 times. And then if I have medial pain, I'm going to look a little duck-footed and do like that. And a good way, if you're not feeling any strain anymore after doing that for a day or 2, and you'd be surprised at how fast these strengthen, these quads, take an ankle weight, or if you're like me, use what you have around the house. This is a pretty heavy shoe, it's a wooden bottom, and I'm going to use that to weight that foot. And that just makes this work a little harder and makes everything we want relaxed, and everything strong that we want strong. That's the swing. We're going to do that 100 times, 3 times a day. It'll take you all of a couple of minutes. The second one, very important. This was taught to me by an orthopedic surgeon who started doing this in his 60s, and at 87, he had still avoided, as he's put it, going under the knife by one of my colleagues. So I had very good knees at 87, in other words. I call this, it is a quadricep flexor, but it's a back of the knee extender. And that's the important part. And if you can see that, all I'm doing is trying, against all possibility, to extend that back of the knee further than it can go. And that's also, again, as you can imagine, aligning even more so that lower portion around the tibia, that tendon there that holds the part of the lower part of the knee together, the patella, here's my femur, it's all, and even the fibula over on the outside, it's aligning it to where it was back before any inflammation or meniscus tear or stretching of ligaments, before any of that happened. And it's pretty amazing how quickly that's going to align it. And I do 1, 2, let go. 1, 2, let go. And you can get pretty fast at these. So 100, 2, let go is pretty easy to get to in a few minutes. Again, 1 set is 100. You're going to do that 3 times a day.
Do you want to keep your feet flexed for that?
And it doesn't matter. All the focus is behind the knee. Good question. Yeah, I think you're just going to forget about your ankles altogether. Of course, do keep those ankles flexible, and that'll help everything stay in alignment. But that's a whole different video. And the third and last knee exercise, very, very important. Again, it strengthens, lengthens, and remember, a long muscle is strong. So we're both stretching and strengthening in all of these exercises. So the most important part, I want you to focus down on my, in fact, I'll put this on here. Focus down on my heels, is this portion of the exercise. So I'm going to go up on my toes, but down and roll. Up on my toes, down and roll. Up on my toes, down and roll. Better if I have a wall over here, but there you go. Up on my toes, down, roll. Up on my toes, down, roll. Up on my toes, down, roll. And better to find a spot, unlike this rug, that's a little more supportive. In fact, let's go ahead and right here. So there, it's nice and solid. Any book that's a little over an inch, even a 2x4 will do it. If this is too high for you at first. And yes, pay attention, kitty. Up on my toes, roll. And it's that stretch right there that your knees are gonna love you for. Up on the toes, down, roll. I kind of stick my butt out a little bit on that roll just to accentuate. And again, we're going to do that 50 times and work up to 100 3 times a day. And I just keep that right there to remind me. Okay, last we're going to do, Joycey's got it, we're going to do the kind of supporting our hips are really important for the knee. So if the hips are tight, they're going to start pulling on this IT band. They pull on the sartorius muscle that attaches right here where a whole bunch of gluteus medius and minimus and piriformis and everything goes right here. And I call it the 21st century ailment. And this will undo all that sitting that we in the 21st century tend to do, which is part and parcel for our knee problems. Okay, excuse me, your hips are just fine. Can you see? So this is the piriformis stretch. The very traditional one, Animal Planet, is like this. That can hurt people, especially if your agitation on your knee is on the lateral side. So what I'm aiming to do is stretching this right here, and you will feel it pulling in that hip socket. You can get that same stretch by protecting the knee, bringing it closer to the other knee, and bringing your knees into your chest a little more. Oh, it feels good. I can feel that right there. And I'm just gonna awkwardly, however it feels like the stretch is doing me some good, I can put it over on the side a little bit. If you can only get up to here, it doesn't matter, as long as you feel that stretch in there. All right, and then always do the other side. And you're gonna hold it for 5 to 10 counts and let go and do the other side. I want you to do 10 of those. That's a set, and you're gonna do that 3 times a day. And then if there's tightness in here, and all of us women that have been told to do crunches because we look better in bathing suits pretty much have that, I'm gonna show you something that's gonna save you a whole lot of visits to the chiropractor and even to the TCM acupuncturist. You're gonna go down like this, lift up your knees, and dig. I call it searching and destroying, and it shouldn't take you long. Pressing your thumbs in toward your hip bone, you are going to find an attachment or two, like mine's right there, that's a little more tender than anywhere else I push. I'm gonna hold that tight, not let go, and then slowly bring my leg down so that I keep the tension and I keep that little bit of a pain, you know, hurts so good kind of massage pain. Very strong in my thumb still, and now I'm gonna wiggle. And you should feel that in the groin muscles, and it's all kind of the anterior part of what we were just stretching over here. It's another attachment down near the pubic symphysis, and that's often very, very tight. So this should open that up. Just do that once or twice, and then the other side. And you're gonna feel like a different person. Last is for the low back, which can also often get caught up in here, especially L2, L3, L4, L5, and then L5 to S1. We've all heard about at least the sciatic pain that can travel down to the knee. So we want to keep that nice and healthy. And what the spine loves to do down there is twist. So we're gonna start with our knees up like about here, and we're gonna do our best to keep them together very slowly. If you can only go to here, do that. If you start to feel that pull and that stretch, then you know you're doing something good for your body. And then do the other side. Eventually, you'll be able to get all the way over. Again, don't do it as fast as I'm doing it. And you might feel a little pop, a little realignment in there, and that's excellent. And breathe into that rotation. Do it to the other side very slowly. If it really hurts, you gotta stop. You never wanna really hurt. And you can really accentuate the twist by looking the other way. Lost my words. And then, when that becomes second nature and doesn't pull and stretch anymore, you can really ratify it and extend it even further by putting the heel on top and switching. And that's the lower back twist. Thanks all. Do your homework, and your knees and your hips and your low back will outlast you.